So good afternoon, everyone. This is Connie Burke speaking from OASAS. Very happy to have so many folks joining us for our first Opioid Settlement Fund community webinar. We have a few things to go over today. We're certainly going to have an opportunity to have folks ask questions. We'll talk about that. But first, I want to turn it over to Commissioner Chinazo Cunningham, who's joining us for our first ever. And have her share a few words. Oh, there we go.
Yeah,
now
thank you for unmuting me. Thank you. Hi, so thank you, Connie. And I'm sorry you can just see a silhouette of me because it's a super sunny day out in New York City. But I just wanted to say a couple of words to welcome everybody and really just say that we're excited to be collaborating with the Office of Mental Health, the Department of Health, and OASAS. And so having, all the programs from across various parts of the system is really important. We also want to welcome the Opioid Settlement Fund Advisory Board. I think there may be board members also attending and participating in this meeting. And we've heard loud and clear from them about the importance of integrating our services as part of what we need to do with these opioid settlement funds, and we are in complete agreement with that. And so, I think this is a great start to having these monthly meetings with providers from across the various systems, community-based organizations, and Opioid Settlement Fund Advisory Board members to really make sure that we're keeping everybody in the loop about all of the really incredibly hard work that we're doing to get to really be in line with the Opioid Settlement Fund Advisory Board recommendations and to get, money out the door and work on the ground happening. We know we're in the worst overdose epidemic ever on record. We know there's urgency, and we really, take this work very seriously to make sure that we can provide services that are life-saving for New Yorkers. So I just want to welcome everybody and thank you for participating and look forward to these meetings.
Thanks, Chinazo. So I am noticing that some folks are commenting that they can't hear. So it may be that you don't have the volume turned up, but if I'm saying it now and you can't hear, you don't know that I'm providing you with some information so that you can hear. So folks, check on your coworkers and your friends and make sure that send them an email or a chat to check in on them to see if they can hear. As Chinazo had said, this is a collaboration between OASAS, OMH, and DOH. We do have folks from all three agencies on and participating in the webinar. Couple of things that I wanted to just go over before we get started. So the purpose of the webinar is for all of us to have a chance to get together, to share information about the current work that we're doing using the opioid settlement funds. We have found with other funding initiatives that too often these sessions are helpful for folks who are receiving contracts, who are in the process of implementing a program. It's a chance for them to ask questions and to get some additional technical assistance around the procurement process or, submitting an expense report, something like that. So want to, be clear that we're really focusing on the work that's being done, utilizing the opioid settlement funds. We are here to answer questions as best we can. This is specific to the work we are doing. I had in the announcement offered that if folks had questions that they wanted to send in through the OSF project management mailbox in advance, that they were welcome to do that, and we would address those questions. So some of what came in is more broad. It's not specific to an initiative. It's more about future spending or recommendations or things that, that the community would like us to consider in terms of use of funds. So I really want to distinguish between that type of comment and what we hope to do during this hour. So again, this hour is meant to be spent focusing on the initiatives, the planned use of funds, the work that we're doing, how we actually go through the technical, the mechanics of getting through the procurement process, the contracting and so on, moving the dollars. For recommendations about use of funds, or, you know, comments, more general comments, please be aware that the Opioid Settlement Fund Advisory Board does have a public comment period during each of their meetings. There is a meeting coming up on May 15th. Thank you, Lucia, for shaking your head yes to that, affirming that for me. So there is a meeting coming up on the 15th. And for everyone, for the community to be aware, that is an opportunity for you to provide feedback and comment in terms of use of funds or recommendations. So with that being said, from the OASAS side, I did want a chance to just kind of speak to some of the initiatives that we have already moved on, and also to give people kind of like an overview in terms of what's guiding our work. So the Opioid Settlement Fund Advisory Board did identify 10 priority areas that they recommended that we focus on in terms of the use of funds. I will challenge myself here. So harm reduction, treatment, priority populations, services across the continuum, recovery, housing, transportation, prevention, media or campaigns, and then also research are the 10 areas. And we at OASAS wanted to prioritize on the harm reduction funding and also moving dollars to get services into the community was our first priority. So I'm just going to give a quick overview in terms of, you know, the work that's happened so far. I'm also going to speak to the regional abatement. So for folks out there, please be aware that through the settlement, there are various pots of money. I'm going to put it in really technical language, but there are the dollars that are available through OASAS that the board is making recommendations on. There are also regional abatement dollars. So these are dollars that are passing through OASAS and made available to the 5 large cities, to the LGUs, to the counties, and then also there are smaller or other litigating entities, small towns, villages, small cities who were identified in the settlement to receive dollars. So I'm gonna jump in with that first, just to give people an update with the regional abatement. In total, there were $64 million made available through the regional abatement. We expect that as of close of business, right? It's the end of the state fiscal year, so we think about that right around now, right before April 1st. So of the $64 million, we've got $46.5 million that has been identified and expect to have that. And I'm going to look at you, Debbie Davis, for a nod. So those are dollars that will be made available and out in the community. Go ahead, Deb.
It's actually increased.
Oh, great. Okay.
Just
I'll take
as
it.
you were, you know, astutely saying that it's the end of the state fiscal year, our system, the statewide financial system, closes down tomorrow. So every day, every second, we are monitoring what payments are actually making it through the system. So I can tell you, just as of an hour ago, 46.7 million for the plans, which represents 47 LGUs, will receive payments. These are payments out the door, dispersed from the financial system. There's another, 300 and some odd about to go. That is also going to be including some of those entities that you were speaking about, the other litigating entities. So we believe our total by tomorrow will be 47 million.
Awesome. That's fantastic. As we've tossed these numbers around, I can't tell you how many hours were spent and how much, we worked and deliberated and what's the best way of making those dollars available through regional abatement. So it was no small task, and I appreciate all the work that was done by folks within OASAS to move those dollars. And it's great that we have a process in place because let's not forget the settlement will continue for another 16 years. So it's great that we have a process in place and that we're collaborating closely with the LGUs to move those dollars, and that we'll be doing this with ease and within the next couple of years, right? So so fantastic with regard to that dollar amount. In terms of RFAs, so for everyone's awareness, we did issue a low threshold buprenorphine RFA. It totaled $7.5 million in value. Those applications were already due in. We're in our scoring phase with that. And I anticipate, and I'm going to look at you, Lucia, that our target date for sending out award letters, I believe, is April 12th. So we're looking to have awards announced by mid-April. At that point, we will enter into our contracting phase, which will take some time. But we're happy to be moving forward on that. That was our first RFA that we issued. We also have our comprehensive outpatient integration RFA. That was approximately $8.6 million in that RFA. It was released a little bit later than the low threshold bupe, but I believe that the application deadline was the same, and we are also looking to announce awards mid-April for that one. So we are also in the scoring phase for those applications. I will say just anecdotally, I know with the low threshold bupe, we did have a robust response to that RFA, so we were really pleased with that. It makes for lots of work for scoring, but it's worth it. It's good work to have to do. We currently have 2 outreach and engagement RFAs that are posted. One of them focuses on the clinic model, which is akin to the work that we had previously referred to here at OASAS as the CODI service provision. Through this RFA, we're looking to expand to cover all counties so that all counties in the state have that community engagement, that outreach service happening. So we have $5 million in that RFA, and then we also have a street outreach RFA that focuses more on that harm reduction and low touch engagement. So different than the clinic model in that really through the clinic model, we are looking to be able to provide treatment services. So it is outreach and engagement, but it's also being able to deliver services in community, sometimes through mobile treatment vehicles. It would be a matter of also, potentially meeting someone wherever they are if they want to, need to have a one-on-one counseling session. So different from street outreach where it is much more low threshold. Both of those are out, and and Lucia, the due date for those applications. I'm putting you on the spot, Lou, so. Oop, there you go.
I believe the 6th, but I will double check and come back.
Oh, okay. Okay, so also know that we're working on additional opportunities.
The 19th. Sorry, Kenny. The 19th.
Okay.
The 19th.
So April 19th, those applications are due, and I believe we're looking to have awards out early May for both of those opportunities. Know that in addition to that, we're working on our addiction professional scholarship program. We're identifying SUNY schools with whom we can partner so that they can offer scholarships for folks who are looking to earn their credentialing. We're also, we've identified funding to support naloxone and fentanyl test strip availability. As I had named those 10 categories, know that we are working right now on developing initiatives that would fall under prevention, transportation, the media, housing, I'm trying to remember now, housing, and then also the research. So we continue to develop initiatives. We will make those available. I'd like to encourage folks to keep an eye on the Opioid Settlement Fund initiatives page on the OASAS website, where we are posting information about initiatives as well as things like the recording from today's webinar. And there'll also be a question and answer document generated from today's session that will be posted on that webpage. So having said that, and very excited to see we have 361 folks participating today, so I think that's fantastic. And I appreciate, I know that there are some board members on, I know that there are LGUs who have joined us, as well as, you know, folks from across our 3 provider systems, so that's fantastic. There is, we do have the ability for folks to ask questions. I do invite you to submit your questions through the Q&A function, which you can find on the right-hand side of your screen. Know that to the best of our ability, we're going to answer questions that come in. Please know if there's anything that, if we're not certain, know that what our responses that we have posted in our Q&A will be our official response to the questions as they come in. So without further ado, I think that we will pivot to the Q&A unless, Debbie, is there anything that you wanted to add to that?
No, I you know, other than that, you know, obviously, you did allude to, you know, once we review these RFAs and they get through the scoring and we understand what the awards are, you know, the contracting part goes through the Attorney General's office and the Office of the State Comptroller before we're able to actually execute the contract. So there's where the little lag will be. But other than that, we're all ready to go and excited about that. So thank you.
Awesome. All right. Okay, so we're going to turn to the question and answer. So please feel free to drop your question in there. And we're going to go through, read the questions, and then I will ask the various subject matter experts who are logged in to support me, help me in providing some responses. So the first question, can we ask for some funding to address snacks for our patients? Debbie, do you want to answer that one, or shall I?
Well, I would just say in general, right, the opioid settlement funds are very restricted for abatement only, and for settlement agreement allowable categories, as well as focus categories that were voted on, you know, and prioritized by the board. So funding opportunities are being made available, you know, based on those priorities by the board and that meet the allowable terms. So, you know, we don't have a procurement, a solicitation that is just being set up to pay for food. You know, but within, certainly within funding opportunities, there will be opportunities to be able to receive funding for all of your operating costs related to the programmatic use that you're applying for under that solicitation.
Great. Okay. Next question, is there a legal services component to the RFAs? I'm not sure how to answer that. I'm not sure that what that question is.
Yeah, I think I need a little bit more of an explanation to try and offer. I'm not sure if they're trying to get at like offering legal service assistance to consumers or otherwise. I think I'd ask for a little bit more clarity on that, please.
Yeah, and I also would say, I mean, just in general, if no one's actually, you know, not everyone, you know, has an opportunity to respond to a request for application or a request for proposal that is being issued, you know, by the state, right? So people might not be familiar with it. But if you go to our website and you open up one of the RFAs, even if it isn't something that you were going to apply to yourself, but just for general knowledge so that you know how it kind of works, it's set up where it's a, you know, it's a form that will walk you through sort of what's the scope of work that this funding solicitation is being offered for to support. Right? And it'll go through that, and then it'll talk about who are the eligible applicants for this particular procurement. And then it'll, you know, talk through what elements are we looking for in a budget for you to be able to talk about what are you really going to do that meets what this, you know, solicitation is asking for. So, you know, would there ever be legal services as a component in RFA? I can't say, but I would say that when we do release the RFAs, it'll be clear on, what are the eligible applicants able to apply for, and what is the scope of work that has the allowable work that you can claim, for payment related to that RFA. I don't know if that helps, but I thought I'd just lay that out.
Next question. Terrific. So I do see that Assemblyman Pirozzolo is on and would like an opportunity to speak. So let me find you as a participant so I can unmute you. So if you give me just a moment. And then certainly any of my co-hosts can assist. I also want to welcome Chris Smith, who's representing for OMH, who's joining us. All right, so why don't we move, so while I'm looking to do that, I'm going to jump back to the Q&A. Legal services, let's see here. How can we be added to the email distribution list to receive updates on these funds and upcoming webinars? That is a good question, because we typically make information available through our all provider send list. I don't know if you represent an organization. Know that we will make the information available on the OASAS Opioid Settlement Fund Initiative page. And I don't believe we posted the webinar information for this round on that page, but we absolutely will going forward. So know that you can always go to the OASAS webpage for the date and time, and also the webinar link, so that you can join the meeting. And then in terms of, the use of funds and information, know that there's also on that OSF initiatives page information on RFAs and the use of funds. So that's a great resource. And we will, let's see, we'll also announce at the end of this session what that web address is, so that you have that information. All right. Okay, going on. Our local correctional. Oh.
Did you want to go back to the Assemblyman?
Are you able to unmute?
Mm-hmm. Yeah.
Oh, okay, great. Please do. Please do.
Yeah.
Hello, how are you? I don't know if you can hear me.
We can.
Yep.
All right. Thank you for taking my questions, letting me speak. Thank you to OASAS, the commissioners, and all the leaders and providers and the stakeholders that are on this call. My name is Assemblyman Pirozzolo, and I'm a representative from Staten Island, the middle portion of Staten Island. And I just want to bring to your attention, you may or may not know, and I understand that OASAS, is working with the settlement fund, and New York City has received its own municipal share. But Staten Island, which was ground zero to the opioid crisis in 2020, at least called so by our mayor, and we are still second in the city, has been left out of any opioid settlement funding. And the reason being is that the city has decided to use city hospitals as a method of distributing this money, and Staten Island does not have a city hospital. So a glaring oversight at worst, right? Or at best, however you want to put it. But Staten Island does have a clinic on Vanderbilt Avenue, which does go through the city health and hospitals, and even they too have not received any money. So it kind of makes it more of a glaring oversight, if you will. So you mentioned that OASAS has restitution and abatement funding that passes directly through OASAS. And I'd like to make sure that all municipal allocations are distributed equitably through all the municipalities. I do believe that this is something that you can advocate for, or at least point out that this has happened. I did testify before the settlement fund, the Opioid Settlement Fund Board, to bring the situation to light. And they too can make recommendations. So while you're not directly involved in the control and the exact dollar distribution, you can certainly say that this oversight is egregious and it needs to be rectified. In talking to some of the mayor's representatives, we have been told that, well, we may not be able to participate in this particular funding allocation, but we can in future funding allocations. Now, what that means to us, a future funding allocation is 6 years away, because this $150 million that is being spent as our direct municipal share is a 5-year program, and we need to be included in that 5-year program. So that is what I'm here to speak to you about, and I'm calling on OASAS to play a more active role in ensuring that these monies do get distributed equitably, and that does include Staten Island. I am sure that when our Attorney General had this lawsuit and won this money, there was no caveat that said distribute this money to New York City, but not Staten Island. So I'm asking for your help.
So thank you very much. Thank you very much. And I do recall you joining the last Opioid Settlement Fund Advisory Board meeting as well. With regard to the dollars that we are talking about here today, in particular, the regional abatement, when we're talking about making dollars available, through communities throughout the state, that regional abatement is specific to all of the state, excluding New York City and Long Island, because there were separate settlements that were addressed for those localities as part of the whole settlement agreement. So in that respect, in terms of the regional abatement, we don't have the ability to change how those dollars are to be distributed or who's eligible to receive those dollars. I will say, with regard to the other RFAs, the other funding opportunities that we're making available, we certainly are looking to address areas where services are needed. And certainly looking at kind of, other funding streams, other service provision, where are the spots, the areas where we need to target or focus services and dollars. So we continue to look at that.
So
I'll just, yeah.
Oh, Connie, it's Tracy. I was just going to add to that. Just thank you, Assemblyman. I know I'm secretary of the board, so I did hear your remarks at the settlement board meeting and appreciate your remarks today. I know that you talked about, what's within OASAS's control. We are very much controlled by the settlement agreements and statute. So the allocation, as Connie just pointed out, that went directly to New York City, we actually have no authority there. So appreciate your comments. We've heard you. I know you said you've talked to the city, which, certainly would encourage you to do that. I think also, if you haven't done so already, would encourage you to send your comments or make the Attorney General's office aware as well, because the Attorney General is the one who is drafting the settlement agreements. So they very much have a role in how the agreements are drafted, and these reimbursements these funds will be rolled out. So appreciate your comments. Just want to let you know we have heard you, have, made others aware of your comments. Appreciate the comments. We are doing our best to make sure the funding within our control is being distributed where it needs to be, that everyone has an opportunity to apply for those funds. But just also would encourage you to continue to make others aware of your comments as well, who actually do have a more direct involvement in the specific funding that you're referring to. So just wanted to add that, in addition to what Connie said, which was a great explanation as to how the funds are being distributed.
Okay, thank you. So I'm painfully aware of everything you just said about not having control. But you do have the ability to make future comments and to say that, hey, we have seen that this has happened and we would recommend that this issue be resolved. And that is what I am calling on you to do, both through OASAS and both through the settlement board. It falls within your purview. And I'm sure just by looking at you shaking your heads as I'm speaking, that you agree that this is an egregious oversight. And I am calling on you to make these comments to the Attorney General. And I don't want to play the game. I understand the Attorney General, secured these funds, and I don't want to go back and forth. But I will be speaking to the Attorney General. I do speak to the Mayor's office, but today I'm speaking to you. And I'm asking you to participate in a conversation which you are more than capable of participating in. I know you don't control specific fund dollars. That's not what I'm asking. I'm asking for your participation in pointing out that there has been an error. Thank you.
Okay. Yep,
Thank you.
understood and very much appreciate that. And we have heard your comments here today as well as at the board meeting. So thank you and appreciate you sharing your concerns and your comments today.
So I'm eager to move on as I see that we have 51 questions in the Q&A. So I'm happy to see that there's vigorous participation here this afternoon. Moving on to the next question. Are local correctional facilities eligible to receive any of this funding? How does a local correctional facility who is mandated by New York State to provide a MAP program to incarcerated individuals, how are they to apply to receive funds from the settlement funds to assist with facilitating these programs? Okay, so I'm going to take a shot at that one. We are looking at eligible applicants and how to make these dollars available and ensure that they do address the needs across the state, to include what you're referencing in terms of making medication available to individuals with OUD in jails and correctional facilities. So we are currently working with the correctional system to address this. In terms of the dollars available, I know that we are also utilizing OASAS funded providers to collaborate and work with facilities. So at this point, I'm also thinking we do have dollars that we have to bring to bear to address something like this, and I would say stay tuned for future funding opportunities.
I would just add to that we do have a category called special populations that the Opioid Settlement Fund Advisory Board made recommendations in, and part of the special populations included those involved in the criminal legal system. So we haven't gotten through all of those categories yet. And so I think that this is, we appreciate that comment, and just know that we will be working our way through those recommendations, and that population involved in the criminal legal system is part of the recommendations from the board.
Oh, go ahead, Debbie.
I also was to add that, the plans that the LGUs that are receiving funding, right, they're going to develop their plans on use. So I would keep your eyes open for any opportunities related to, how the LGUs or even how the other litigating entities might be using their funding. And, because, and also what you can do, again, go to our website, the website specifically for opioid settlement fund, initiatives. When you go in there, there's a state abatement form. When you go into that form, it shows you, what the regions get, what the other litigating entities get. And at some, once they start preparing their procurements, there may be funding opportunities there as well. I just wanted to say that.
Thanks, Debbie. That's a good point. Next question, are the addiction scholarships CASAC specific? Also, will they be only through CUNY? So the scholarships are going to be for CASAC, so the credentialed alcohol and substance abuse counselor credential, also the CPP, credentialed prevention provider, as well as for the CERPA, the certified recovery peer advocate credential. And we are going through the SUNY CUNY system to make those scholarships available. There's a question, what was the title of the RFA for harm reduction outside of the clinic setting? So that is the Outreach and Engagement Street Outreach RFA, and information about that is currently posted on the OASAS procurement webpage, as well as under the Opioid Settlement Fund Initiatives page. Next question, local settlement dollars have been distributed in two categories, restricted and unrestricted. Will the abatement dollars be broken down in the same manner? Debbie, thank you.
Yep, so the Attorney General, and this is kind of the separation that we were referring to earlier, the Attorney General negotiated settlements that got paid out to subdivisions, including New York City and Long Island, but other subdivisions. And those fundings that they had distributed that were outside of OASAS, it didn't come through the state treasury, it didn't come through our office. That got distributed, and some of the dollars are restricted and some of the dollars are unrestricted. For the funding that OASAS is responsible for and comes through the state, they are all restricted to being used for abatement purposes, purposes related to treating, preventing, harm reduction, recovery for, substance use disorders. So it is meant to deal with the opioid epidemic. And so there's no separation in two different types of use. It is strictly for abatement purposes.
Thanks, Debbie. Are for-profit agencies eligible to receive these funds?
I can take that as well, T, I saw you looked upset. But in the OASAS budget, since the funding is in our budget, we are not able to provide funding directly to a not-for-profit. So our RFAs and such will say, I said the wrong thing, to for-profits. Let me restate that. We're not able to provide a grant to a for-profit. We will be able to make our solicitations, and all eligible applicants to apply for those would be not-for-profits. However, there's a significant amount of money going out to the regional shares. So we've talked about 64 million, which we have 47 million out the door, right? Any of that funding can, there's not restrictions on that money other than it has to be used for abatement purposes. So I just wanted to share that.
Okay, thank you. Will there be an RFA or funding for evidence-based practices like contingency management? I do know that we are in our solicitations, focused on using evidence-based practices. I do think that where there are opportunities for providers to identify an EBP for implementation, we certainly want to make that an opportunity. I would say keep an eye on those additional opportunities as they come along. Keep an eye on that OSF initiative webpage. Once the contract is processed, is the award dispersed or are there reimbursement contracts?
That's a great question. Thank you so much for asking that question. So if you're a provider who's been certified, funded, or otherwise authorized by OASAS, or I guess maybe more funded, you've experienced how we provide state aid out to providers. So meaning that we pay on a quarterly basis. So the funding will be made available that way if you end up with a multi-year contract. And if it's a one-year contract, it'll be similar to the way we do legislative ads. So either way, you will be receiving the funding up front and reporting in the consolidated fiscal reporting system.
Okay, great, thank you. What kind of credentials will the scholarship cover? As mentioned, the CASAC, the CPP, and the SERPA certifications will be included in the scholarship effort. Another question, for those of us who are not accountants, can you explain the abatement difference definition of this funding? T, do you want to explain the abatement? I think we're talking about the regional abatement and how that differs from the dollars that OASAS is using and DOH is using to support initiatives.
Sure, and Deb, feel free to jump in, but I think the difference between the abatement dollars that are going to the locals and the money that's going to OASAS is largely a financial function. So we received money through the various opioid settlements, and the pots of money went either directly to certain entities, for example, New York City, through a third-party administrator, or it went to a state fund. And as part of the dollars that were set aside in the state fund, there was a portion which was specifically laid out in the settlement agreements to go to political subdivisions or local government entities or other litigating entities, as we like to refer to them, for them to use based on kind of their more regional needs. So I think it was kind of an exercise of looking at statewide needs, which might be more global, and the relevant state agencies working together to address the more global issues, and then also these pots of money to address the more local needs.
Yeah, I think I'll add to just say, when we refer to state abatement funds, we're talking about those funds that came as a result of the settlement agreement that comes through OASAS, comes through the state, through our fund, but they're all abatement funds, right? But then some, as Tricia Allen, our general counsel, just explained, that some are designated by the settlement agreements themselves to be given, to the region, a regional area, or other litigating entity, or a large city. It's named in the agreement, and so is the amount. So that goes, that goes the way that it goes. And then for the remainder, then we are going through a process where we've received the report from the board. They've listed out their priorities, and we're making funding, it very much aligns with the agencies working together to address the epidemic holistically, comprehensively, and we're putting out procurements related to that effort.
Okay, next question. Are there additional mechanisms for an OASAS 822 to become a CODI outside of applying for the RFA you just referenced? So we're no longer using the term CODI. Really, those providers who had received dollars to work in community were essentially charged with delivering outreach and engagement outside of the clinic. And so we are looking to expand, and really any OASAS outpatient program has the ability to go into the community to deliver services. Right now, in terms of supporting those providers and doing that, the current RFA that's out there is the existing mechanism to add additional outpatient providers to that effort. Next question. Hello all, and thank you for the opportunity. Very curious if there will be funding available to build a robust MICA service. They are so far and few between, so needed, even if not solely funded by OASAS. Will there maybe be something collaboratively with OMH? Any guidance or even possible resources to explore that? So, Chris, I don't know if you have anything to say to that. I would rely on Pat Lincourt for a response here, and she was unable to join us in this meeting this afternoon.
We're working, OMH is working with OASAS on a number of projects. We're developing jointly licensed crisis stabilization centers and implementing them across the state. And we have a budget proposal to expand CCBHCs, which are jointly licensed, not yet, jointly overseen by OMH and OASAS. And we're also working with OASAS and DOH on updating and hopefully streamlining and improving our integrated outpatient regulations to make providing integrated outpatient services more flexible and easier to obtain. So there's a number of things going on along those lines. On the OMH side, you know, we're looking at a number of new initiatives that'll hopefully be passed within the budget this year. And for many of them, throughout the entire array, we're looking at using those resources to develop better integrated mental health and substance use related services. So feel free to reach out to discuss your specific idea here, because we're really, you may have seen, we're having stakeholder sessions across the state right now and are really looking for this kind of feedback to help us make sure we're getting out the types of services that people really need and want to be able to provide. So I would love to hear specific ideas from you to help shape what we're doing here. And we're involved in the planning of a number of these initiatives as well. Thanks.
Thanks, Chris. Next question, has OASAS and/or the advisory committee considered funding the increased testing demands on medical examiner toxicology labs whose stats and work everyone relies on? So I believe that falls under the purview of DOH. I know Joanne Moore has joined us. Joanne, is that anything that you can respond to?
Hi, everyone. Connie, if you could do me a favor and just repeat the question again.
Oh, sure, absolutely. It's asking if OASAS or the advisory committee considered funding the increased testing demands on medical examiner toxicology labs whose stats and work everyone relies on. And of course, that falls under the purview of DOH. So I thought you might be able to respond to that.
Thank you for that. So while I won't today speak on the specifics of what could be funded, certainly looking at the ability of medical examiners and coroners to be able to enhance or expand on their work and on the use of such lab reports is a priority for us. So this is a conversation that had started even before the opioid settlement funding was in place. And I know that there's a lot of partnership happening across the state in this discussion. And we will take back this particular item that you've raised as a point of consideration, if not already noted. Thank you.
Thanks, Joanne. Next question, will all funding only be open at OASAS licensed agencies? Will RFPs be restricted to traditional OASAS services and structure, including certain certifications?
Yes.
Versus
it's all right. It's just OASAS.
Oh.
Come on in. All right.
So, Lucia, can you identify that person and mute them in the participant list? I'm not sure how they were able to unmute. It could be our assemblyman.
What do you do?
Oh. All right. So, getting back to our question, sorry for the interruption. With regard to who's going to be eligible, so we actually are making an effort to ensure that we're aware of providers who are delivering services throughout the state outside of the OASAS licensed system. This is something that came up at the last Opioid Settlement Fund Advisory Board meeting, and in response, we did send a request to all LGUs to help us identify their community-based organizations that operate within their county so that we can better identify them and include them in funding opportunities. And then I'll also add that in terms of the RFAs, we are including providers outside of the OASAS system. So there are providers eligible who are within the OMH system as well as under the purview of DOH. It's specific to each RFA. Okay, housing is a significant issue for people with substance use in rural counties. We have a very limited number of hotels who will accept, and we don't have shelters. I see housing made the list of priorities. What can we expect in regard to this? So we are developing our opportunities with regard to housing and the other areas that I had mentioned earlier. I don't have specifics that I can provide at this time with regard to those efforts. Two, I mean, for folks to be aware, you know, we do need to be careful about how much information we share, what we share, because we are going through our formal procurement process, and we do want to make sure that we make every opportunity fair and available to everyone who's eligible. So we have to be careful that we don't get ahead of ourselves in talking about these in too much detail ahead of the release. Besides the scholarship and training initiatives, are there other workforce initiatives planned? Thanks for that question, Karen. So right now, we are supporting the scholarships. We're preparing to release those and have identified additional workforce needs that we want to address. One thing for folks, I think would be helpful to keep in mind that this isn't one and done funding, right? We are going to receive dollars over the next 16 years. So we will continue to address additional issues as time goes on and as dollars are made available. So certainly it's on our radar and we are considering additional initiatives. How are RFA reviewers selected, and what is the process to become a reviewer and or increase the number of people of color as reviewers as OASAS seeks to improve delivery of diversity, equity, and inclusion strategies? In terms of developing our scoring team, we do draw from the staff within OASAS. We do look to include staff from throughout the agency. We do look to have the scoring teams be representative. Every reviewer does need to attend a training session on the scoring instrument. And in terms of two standing pieces within all of our RFAs with regard to diversity and equity, and then also in terms of co-occurring service delivery, we do have specific teams that are trained to score those sections. A comment with regard to RFPs that may come out so close and swiftly, we may not have capacity to apply to as many as we would like. Pacing may be an issue. Thanks for that comment, Kimberly. I hear you. I definitely hear you. This is a recurring challenge that we face in that we are eager to make the dollars available. We're eager to have services be put in place. And at the same time, there is a balance in terms of the community, our provider community being able to have the bandwidth to be able to respond. So I am noting that, and we'll take that comment back. There's a question with regard to OASAS weighing in on the New York City distribution of the $150 million in settlement funds and the fact that Staten Island has been omitted. I don't believe OASAS has additional information to provide at this time. Another question, when are the RFAs coming out? So the RFAs, I mean, we were aggressive in trying to make opportunities available. We were making them we were releasing them weekly. In some instances, you know, every 2 weeks, we were trying to make an opportunity available. That information is posted on the OASAS procurement page, as well as the OSF, the Opioid Settlement Fund Initiatives page. So if you go to the OASAS site, you can find that information. And thank you to Lucia, who also provided that, although I don't think everyone can see the Q&A. So know that the address that you will use to find information will be included in the question and answer document that's posted on the initiative's webpage. Will any funding actually address the workforce difficulties we're having and income not being living wage? We have lost our licensed staff to private practice. New programs are great, but if we can't hire, it is useless and causing more strain on workforce recruitment. Thank you for the comment. We are aware of the strains that our provider system is under, and also recognize the point that you're making with regard to the living wage, and also we're aware of the fact that there is increased competition and other systems are positioned to offer greater salaries, and that poses a problem and is a definite strain on our system. So we are aware of that, and we are looking at ways to try to alleviate that strain and look at wage. For awarded agencies, will the contracts be through OASAS, OMH, or both? So all of the contracts for the OASAS RFAs that are released that include OMH providers will be issued through OASAS.
Connie, I just wanted to add on to that, if I might, just to utilize this time and just say that I had mentioned earlier in this call that the contracts get reviewed by the Attorney General's office and by the Office of State Comptroller as part of the state procurement process. And also what's included in that state procurement process is that any entity that's going to receive money from us related to these procurements would be, as we had already talked about, a not-for-profit. You need to have your documentation updated every 6 months in Grants Gateway. That's Grants Gateway's rule, not mine. And you have to be in the charity's website updated as well, which is the AG's website. So those questions will be asked if you end up being an awarded entity. We would not be able to move your contract forward if those two things are not, in place. So just, for those of you who are already receiving money, already have contracts, just make sure you keep updating your paperwork in those websites. Thank you.
Thanks, Debbie. So I am aware of the time. It's 1:59. An hour clearly is not enough to get through all of the questions that folks have. I do want to remind everyone that for the questions that were answered here today, as well as any of the questions that remain unanswered, we will capture all of the questions. We will put those into a question and answer document that will be posted to the OASAS webpage. So we will respond to all of these questions through that mechanism, recognizing that we don't have time to answer all of these questions live during the webinar. Please know that we will continue to have these 1-hour webinars available the last Wednesday of the month at 1 o'clock. So this will be a standing opportunity for folks to join to hear about updates on the use of funds and then to also ask questions. So I apologize to those whose questions we did not get to, but please be reassured that we will be providing responses to all of these questions, and that information will be posted to the Opioid Settlement Fund Initiatives section of the OASAS webpage, and it will include a recording of this session. So please feel free to share with others, let them know, and we will do a provider send to let you know when that information is posted and available. So it's just 2 o'clock. I thank everybody for joining. I thank Chris Smith from OMH and Joanne Morn from DOH for joining as well, and look forward to the next session. Thanks, everybody. Have a good day.